Normal functioning of the eye. The eye is a ball filled with a water-like fluid. Light enters the eye through a thin transparent membrane called the cornea. A portion of the light is then let in through the pupil, which is an opening in a muscular membrane called the iris. The iris is the colored part of the eye, as seen from the outside. Like the aperture of a camera, the size of the pupil opening can be adjusted by the dilation of the iris. In bright light conditions, the size of the pupil is reduced to limit the amount of light which enters the eye. And in dim light situations, the size of the pupil is maximized to increase the amount of light which enters the eye. Light which passes through the pupil enters the lens. The lens is made of a fibrous jelly-like material, and it refracts the light passing through it to focus it on the retina, producing an inverted image on the retina. Unlike the lens on a camera, the lens of the eye is able to change its shape by contraction of the ciliary muscle and thus serves to focus both near and far away objects as desired. The inner surface of the eye, known as the retina, contains the rods and cones which serve to detect the incoming light. These rods and cones send nerve impulses via the optic nerve to the brain. It is in the brain that the image is corrected and perceived. Cataract. A cataract is a clouding of the normally clear lens of the eye. As light cannot be correctly focused on the retina, it causes blurred images to be formed. This leads to symptoms like blurring of vision, glare or light sensitivity, poor night vision, double vision in one eye, needing brighter light to read, fading or yellowing of colors. The amount and pattern of cloudiness within the lens can vary. If the cloudiness is not near the center of the lens, you may not be aware that a cataract is present. Cataract is commonly due to aging of the eye. Other causes of cataract are injury to the eye, long-term unprotected exposure to sunlight, family history, medical problems such as diabetes or medications, especially steroids. Treatment. Surgery is the only way a cataract can be removed. However, surgery should only be considered when the cataract causes enough loss of vision to interfere with one's daily activities. Alternatively, a change in the eyeglass prescription may be sufficient to manage the cataract. Protection from excessive sunlight by using anti-UV coated glasses may help slow the progression of cataracts. Cataract surgery. Depending on the patient's condition, cataract is removed by one of two methods: phacoemulsification or extracapsular surgery. Phacoemulsification or phaco. A small probe is inserted through an incision made on the side of the cornea, which emits ultrasound waves that soften and break up the lens so that it can be removed by suction. Extracapsular surgery. After making a long incision on the side of the cornea, the cloudy core of the lens is removed in one piece. The rest of the lens is removed by suction. After the natural lens has been removed, it is replaced by an artificial lens called an intraocular lens, IOL, which is made of plastic. Light is focused clearly by the intraocular lens onto the retina, improving vision. The patient does not feel or see the new lens.